Well, now to this. Tonight, we're diving into the impacts of a new move meant to clear medical debt for millions of North Carolinians.
Governor Roy Cooper announced just this week the state will partner with hospitals to forgive medical debt for eligible low-income patients.
In all, the governor's office says around 2 million people are eligible for this, and up to $4 billion in debt could potentially be relieved. But how exactly is all of this going to work?
Well, WCNC Charlotte's Julia Kaufman is joining us now in the studio to explain here. Julia.
Guys, yeah, to get hospitals on board with this plan, the state is offering them higher Medicaid reimbursements as an incentive. So participating hospitals will offer medical debt relief for uncollected debt for eligible patients starting back to January 1st, 2014 up until now and moving forward. So you have to meet a certain level of criteria in order to be eligible for this medical debt relief. The first one will be if you are enrolled in Medicaid, you could get this help, but you don't have to be. Another eligibility could be if you make up to $52,710 a year or less. But keep in mind that these income requirements vary based on your household size, and they're set by the federal poverty levels. And then lastly, if you don't meet one of those, but your medical debt exceeds 5% of your annual income, you are also eligible. So in order to make this happen, the state is partnering with a nonprofit called Undue Medical Debt to issue this relief. We spoke with CEO Allison Sesso. She explains why medical debt can be so impactful for struggling North Carolinians.
They don't go back to the hospital to get the care that they need. They feel overwhelmed by the thought of having to pay this bill that they know they're not going to be able to pay. So that creates anxiety and undermines their well-being overall.
So the state says eligible patients will not need to take any action to have their debt relieved. The program aims to wipe bills away over the next 2 years. Sesso says it's going to take several months, though, or even a year to sign hospitals on, analyze the debt that they're owed, and then identify and contact those patients who are eligible.
All right, Julia, thanks for breaking that down for us. We appreciate it.